Hello, everyone, and welcome to the 39th Virtual Roundtable on Measuring Corruption. I'm your host, Joseph Poche Alvarez, and I'm very happy to be joined here today for a presentation by Jetson Leder-Luis, who will be talking about how to detect fraud in public agencies. I reached out to him a few months ago because of a work that he had done for the World Bank some time ago. He had a paper just come out quite recently on Kenya as well. Um, so I thought it was perfect timing, especially considering everything that is happening in the US and around the world, to have a voice from North America and explaining about how we can, what type of systems are available, and what is the size of the challenge really ahead of us. This conversation, of course, is more related to detection, but it very much is related to measuring of corruption because, of course, if we cannot detect, we cannot try to capture statistically any sort of pattern. So I thought that this would complement very well the type of conversation that we have had in the past. So just so you know, the meeting will last 90 minutes as usual. We have about 45 minutes worth of content from Jetson. You don't have to wait until the end if you have questions or comments. You're more than welcome to, just put the hand emoji, and I will invite you to unmute yourself, and you can make your comments, ask any questions concerning the point that Jetson may be discussing at that moment. And yeah, otherwise, I will ask you to please keep your microphone muted. And of course, when you decide to participate in the conversation, it would be excellent if you could start by, at least the first time, by introducing yourself. So your affiliation, what a specific area of corruption or anti-corruption are you working on, that sort of thing. All right, so I won't take much of your time. I invite now Jetson to take the floor, and Jetson, you can start sharing your slide whenever you feel ready as well. And if you could also say a little bit about yourself to kick off the conversation.
Excellent. And thanks everyone for having me here to present today. I really want to highlight what Joseph said, which is, I'm an economist, and so we love interruptive seminars. We don't, none of this question and answer at the end stuff. So if you don't interrupt me and I have to speak for 45 minutes, it'll be the longest I've ever been allowed to present continuously. And that would just make me deeply uncomfortable. So I really appreciate any questions that you guys would have in the middle of the talk. The norm in my discipline is that you raise your hand and you ask questions. We don't save it for the end. And so I appreciate your feedback. Let me go ahead and share my screen. And just, great. Okay. And then I'll full screen this. Where is the full screen button on PowerPoint? There we go. Okay, can you guys see this and is it full screen? Okay, great. Hi, everyone. I'm Jetson Leder-Luis. I'm an assistant professor of markets, public policy, and law at the Boston University Questrom School of Business. And I'm also a faculty research fellow at the National Bureau of Economic Research in Cambridge, Massachusetts. I received my doctorate from MIT Economics in 2020, where my dissertation was called The Economics of Fraud and Corruption. I'm a fifth-year assistant professor. I work on fraud, and I want to talk to you today about what that means with a real eye towards questions about measurement, given the general interest of the people here. Although, spoiler, I'm going to talk a lot about policy as well, just because that's sort of the world that I live in. Okay, so just as an outline of what I'll be doing today, I want to talk a little bit about fraud in government and make a distinction between fraud and corruption. I've done some work on corruption, but I would say really I study fraud. They're very deeply related topics, and I think that a lot of the work that I do on corruption is relevant. Excuse me, the work I do on fraud is relevant to the corruption community, but it's good to think about how we scope these problems differently and and what they are. And then I want to take a few minutes here to tell you about some research papers that have come out over the last few years that I've worked on that have some, I think, important ideas both for how we measure fraud and corruption, as well as some of the policies that governments around the world use to eliminate fraud in public programs. And then I'm going to, as Joseph alluded, deep dive into a paper that is coming out next month in World Development, a paper on fraud in a World Bank project in Kenya. And we're going to spend some time talking about that paper, which is a measurement and methods paper. Obviously, that's a relevant piece for this crowd in particular. And I'll talk a little bit about the way in which that paper attempts to measure bad behavior, which is somewhere between corruption and fraud in that context. And then I'd be happy to spend some time doing question and answer at the end. I'm sure that many of you have seen headlines related to changes in US public integrity and program integrity policy at the federal level through a new organization that Elon Musk is spearheading called the Department of Government Efficiency. I have some insights into what is and isn't happening over there due to some informal conversations I've had with the government. And so I'd be happy to answer questions about my perspective on that. Okay, so let's talk about fraud versus corruption. We all here have a good sense of corruption. I would generally define corruption as when a person who works for the government misuses that power for personal gain in some way. Fraud is a little bit different. And really where it comes from is that governments around the world administer public programs, often through private companies or by direct relationships with beneficiaries. And so we may think about corruption as, you need a permit from the mayor's office in order to build something, and someone at the mayor's office is holding you up. That would be sort of corruption. Many programs don't have the direct relationship between the beneficiary and the government in the same way, but rather the government is paying for a good or a service to be purchased. And fraud arises when either the company or the beneficiary has an incentive to lie in order to make more money from that service. And so it's very related to corruption in that the downside is that there's government money that's going to the wrong place, and that there's this sort of distortion and, kind of moral outrage that these public programs are being abused. It's somewhat distinct because it's not necessarily that the person who works for the government is responsible for that, but rather that there's a flaw in the program or the program is being exploited, often by private companies that work for the government. So it's sort of a corruption adjacent is, I think, the right way to think about this. Fraud affects all areas of government spending. I've done a lot of work on healthcare programs. The United States has two major federal healthcare programs. One's called Medicare. It's our old age insurance program. And another one's called Medicaid. It's our low income insurance program. And there's been extensive fraud in both of those programs, totaling probably about 50 to $100 billion a year. The US, for comparison, spends $1.5 trillion on the two programs combined per year. And so $50 billion is, that's not the biggest share, but it's like a massive amount of money in terms of world scale. And that has affected all different sectors within healthcare. And we're going to spend some time today talking about healthcare fraud. But fraud is also in all areas of government spending. I'm going to talk today about fraud in a World Bank project. That's a form of government spending that's conducted by NGOs. You may have seen recent hubbub around USAID, which is a major US government program that may or may not be shut down depending on some kind of pending court decisions. We also see fraud in direct benefit programs where the government pays towards individuals, like unemployment insurance, or what the Canadians call it, employment insurance. There's also programs like disability insurance. The United States has an old age pension program that we call Social Security. There's some allegations of fraud in those programs as well. And this is not a United States specific problem, right? We think that all of these programs have parallels in Europe, in Asia, in the developing world. The governments provide health insurance, disability insurance, unemployment protections, all of these things, and all of those programs can be subject to fraud. There's also fraud in programs where the government tries to build and provide public goods, like infrastructure and transportation spending can have fraud, as well as defense spending. I haven't written on either of those topics yet. I've written about everything in the first three lines, but there are some really interesting areas of open research, I think, in the latter. Generally, one of the problems is it's easier to get data about the social programs than it is to get about, for example, defense spending. Go ahead, Joseph.
So no, I definitely don't want to get nitpicky, and we talked a little bit about this the other day when we had a call. So this reminds me the conversation about fraud being corruption adjacent. I've been kind of like racking my brain about this thing for a number of years, and I remember back in 2020, I kind of like did a little bit just for fun. I did an informal poll among a professional network with some vignettes of different cases of abuse
Yeah.
and fraud, corruption, just to get an idea of how people would use the word corruption. So basically, the question is, would you consider this to be corrupt or not? And and it appeared to me that very much depending on the professional background of the person responding, right? Like for example, lawyers will say, "Oh, that's definitely not corruption. That
Yeah.
can be theft or that can be fraud," right? Because very often in many parts of the world, corruption itself is not in a penal code, it's not in the criminal code. So there's no kind of specific, like there's bribery or embezzlement. There are other
Yeah.
terminologies, right? If you cover this later on, please, just to keep my question. But I was wondering if there is in this issue of dealing with fraud on the one hand, and because we're not really dealing with services that are provided directly by the government, but through private sector entities. If
Well,
there
we'll
is
talk today
still,
about, yeah.
if
We'll
I
talk today
was,
about unemployment insurance. And unemployment insurance, there's no firm, right? The government gives the money
oh,
to the
right,
person. So there are some of these programs, but there's still a fraud element. So let me show you where I draw the boundary between corruption and fraud.
okay,
It's a legal distinction. In general, we have statutes in laws. I'm more familiar, obviously, with the American Penal Code than I am with the European Penal Code or the Japanese Penal Code. But there are laws that prevent, for example, taking a bribe when you're a government employee.
right.
And that's a corruption problem. There's also a law called the Foreign Corrupt Practices Act that prevents US companies from paying a bribe to a foreign government employee. But the boundary between what we call corruption, right? The United States has a Department of Justice as our main federal lawmaking, excuse me, law enforcement organization. The Department of Justice has a section called Public Integrity. The
Mhm,
Public Integrity Division, they're within the criminal division of the Department of Justice. They investigate senators, congressmen, city councilors, mayors, the president,
mhm,
but they would not investigate a company that
mhm.
was stealing money from a public program because there are just totally different statutes. And so when I say fraud versus corruption, I'd say it's kind of a legal distinction in terms of whether or not we believe it to be corrupt as an adjective. Yes, it's corrupt in that there's public money and it's being stolen, and that's bad.
Right. So
But
fair enough. So I was wondering if now, when it comes to policy or the use of certain systems, right? And specifically, I'm thinking about ISO 37001, right? The anti-bribery compliance system. So I was wondering if when dealing with fraud, there's also some borrowing from anti-corruption or anti-bribery systems at all, or if they're just considered a separate thing, let's say.
one of the things that's fantastic about the field of anti-fraud is that no, I think that there's been so much work that's been done to make governments have this layer of integrity, and so much less that has been done to make sure that the companies or the individuals or the beneficiaries or criminals aren't stealing from the public programs. And so we don't have, like, here's a good example. There are all of these financial controls that apply to officials. If you try to do banking in the United States, you are required to disclose whether you work for a foreign government because there's all of this like prohibition on moving money around if you're like stealing money. We just don't have the same thing for US public programs. And so we have all these cases of like people who or companies that contract with public programs where the federal government doesn't even know who owns them. And so there's actually a very distinct lack because of these legal distinctions where that boundary has been drawn around who's a public official and who's not. We also have gaps in the enforcement. So I think it's an interesting. I don't want to spend too much time on this. I think Dina had raised her hand for a question.
Dina?
Hi, so I'm Dina Bobanova. I'm working on corruption mostly in low and middle income countries, but at the moment I'm co-chair of a Lancet Commission, Global Health Commission on Corruption, where we're going to collect a lot of evidence in different income settings. And that's why I'm really keen to follow up with you, Jetson, after that, because I think some of the work that you do is really of interest to us.
Great.
So one thing I would like to say, we've had extensive arguments about this distinction in wording. And with WHO, we work with kind of big group, but we find that very often it is in particular countries, they use particular terms. It's also translation or language issue.
Yeah,
So our approach is to be comprehensive
I
because
think that's right.
you're right that actually in Sweden, we found out that if you talk about corruption, it's not in the health sector. They'll say we don't have corruption, but if you go to the court records, they have corruption. They have cases of corruption in the health sector. So it is in every country we have a different degree of what's pursued by the court system and the legal system. So we found that the only way, if we are doing cross-country research, is to use the word corruption and include fraud in it.
Yes, I think that's totally reasonable. And for the purposes of everything I say today, you should feel free to lump it under corruption studies. I mean, there's a reason I'm here, and this is a corruption organization. My main advisors at MIT, one of them was Ben Olkin, who's a corruption guy, right? Like this is why I'm from this world as well. I just want you to think that the main distinction that's going to define my research is that the bad actor is not an employee of the government.
Okay, thank you.
Yeah, absolutely. Okay, so moving on, thank you, and please continue to ask questions. So I want to tell you about what I do. So I answer questions about fraud in government spending, and there are sort of three sets of complementary questions that I work on. The first is the detection and measurement question. How can we detect fraud in government claims and spending data? There are sort of two big reasons for this. The first is I think measurement is per se valuable. I think it's interesting to know how big these things are and also what systems can the government use to stop it. Because if you can't detect it, you can't stop it. But also because I'm an economist and I run regressions and I need left hand. Oh, I'm so sorry. I take eye breaks. I'll turn them off. I take, yeah, it's the only way to keep your eyes good when you stare at a computer all day. Okay, great. Let me keep going. I'm an economist and I run regressions, right? And so I need left-hand side variables for my regressions. And if I have no measure of bad behavior, I can't study policies that are supposed to target bad behavior. And so a lot of what I do is try to say how much is there so that I can then measure it and then figure out which policies stop it. And so I think of detection and measurement of corruption and fraud as having this dual purpose. One is the direct policy angle, which is just we don't want it, so we need to be able to see it, so we need to know how big it is, and we need to be able to detect it. And then there's this other, which is, well, we also want to know which policies are effective, right? And we want to know have causal inference and all of this. And so we need it for research purposes. That feeds right into the second piece, which is what policies are used to stop fraud. Are they effective? Why not? And this is the feeling of sort of applied economics and policy work, but also often dives right into law and economics. Why is criminal versus civil litigation more available in this case? When should we use administrative regulation versus use the courts, right? Like all of these sort of topics in policy. And then my final set of questions are about the effects on public programs. The programs I study generally are high value, unemployment insurance, Medicare, old age health insurance. And so a lot of the work that I've done tries to ask, okay, so when there was fraud or when the fraud was stopped, what downstream effect does this have on actually the functioning of the program? Are more people going to the hospital or fewer people going to the hospital? Are people dying more often or are people dying less often, right? And so some of those measures. I think a lot of this comes out of the fact that a lot of the work that I study is in the public health programs, health insurance programs. Okay, so fraud, like corruption, is hard to detect. And it's hard to detect because people who commit it try to hide their behavior. And so when I look at large government claims data sets, and I'll tell you about some of the data that I have, but I can see, billions of lines of things that the government has paid for across many different programs. There's not a column that says this is fraud or this is not fraud, right? This isn't something that comes to us with the data. One thing I've done a lot of work on and I have a large lab, I have a lot of PhD students and undergrads and stuff like that, is building data sets of like who got caught for fraud for a particular fraud. But that's actually also a biased sample, right? Because there's imperfect enforcement. And so the people who manage to get caught aren't necessarily representative of all of the things that are going on in the market. And so I always worry about using that. A lot of my papers sort of start with the people that get caught as a way of trying to understand the behavior, but generally you have to extrapolate by that. And there's a real problem here, right? That just knowing not only what is fraud, but how big it is has this data manipulation problem. The other thing is that in general, there is a cat and mouse game going on between the government and people who commit fraud against the government, and the schemes have gotten more complicated over time. If you look back 25 years, a lot of the frauds were very simple. Patient goes to the hospital, hospital writes down a more complicated diagnosis and sends an expensive bill, right? That's pretty easy to pick up. And there were a lot of great research 25 years ago that showed how big that was. It just doesn't happen anymore. As the government has adopted IT, as the companies have adopted IT, these systems are getting more and more complicated. These fraud systems, the schemes have gotten more and more complicated because of the increase in controls. But that also poses challenges for us as academics in detecting it because it's gotten harder to detect frauds because they've gotten intentionally harder to find in the data. Okay. And then the final thing, which I don't have to tell you guys about this, I mean, you guys know this, is just the lack of data and transparency. It is really hard to measure bad behavior in the government when governments are unwilling to put out data. A lot of the data that I have access to is subject to pretty extreme data use restrictions. Sometimes it's extremely expensive, where they require me to pay the government sometimes like $100,000 or more in order to get access to data, public data. Sometimes the government requires other arms of the government to pay it in order to access that data. I've seen a lot of that. And there's just not as much publication and transparency of data on public programs as we would like. And I think that that's been a real hindrance to detecting fraud in public programs. Okay, so the way in which governments try to flag corruption and fraud, particularly when it comes to public program data. We're talking about claims to a health insurance system, claims to a disability system, pensions, anything where there's a lot of lines of data. There are basically sort of two sets of approaches that the government is using and that academics are using to try to measure this. The first are what I'd call top-down approaches. The government has a lot of investigations and enforcement against fraud. Lawsuits. We talked about the Department of Justice, which is the US's main lawmaking arm. They go out and they try to find people who've committed fraud. The United States has a investigatory and a police arm at a national level called the Federal Bureau of Investigation. The FBI has people who try to find financial crimes against public programs. They're boots on the ground. They're guys with guns. They're knocking on doors. They're investigating people. They're following leads, etc. This can be very effective at uncovering fraud, a particular scheme or a particular person, but it's really resource intensive. I've done some work trying to estimate, and I think something like a criminal anti-fraud lawsuit in the United States costs the government something like in excess of $250,000 in resources per case. The government also uses a lot on whistleblowers. We'll talk about a paper of mine in a moment that discusses whistleblowers. There's this other idea, which is we can sort of crowdsource information on fraud in public programs. It sort of depends on the existence of an individual who has insider knowledge and is willing to talk to the government about. And then the government also does some resource intensive auditing where they'll say, let's go back and look at all the claims that, or some subset of the claims that went in this program, say a pension program or a disability insurance program. Those are really resource intensive and they're not perfect, right? Because if a person has a good fraud scheme, it's not clear that an audit is always going to catch it. And there's one thing that I want to highlight here, which is people think of audits as being these like deep forensic things. And most audits are actually not forensic audits. There is such a thing as a forensic audit. That's where you go and you like assume that there's bad behavior and really try to dig. But like most audits are like, did the check number get written down in the registry? Did the amount that got paid out match the thing that they logged in the book? And so it's actually, most audits are not so sophisticated that they can't be defrauded. Okay. Increasingly, industry, academia, and then sort of third place, the government are interested in high-tech solutions to detect and measure fraud in these public programs. The most basic one are what I just call red flags. A red flag is like, hey, this person seems to have gotten 10 times as much money as everyone else. And you'd be amazed the extent to which there's no internal control in a lot of US public programs. There are forms of fraud that are what I would call really obvious that the United States government at least still pays. And I think that this is true around the world. And it's largely because they do not have automated detection systems that are built for this. In contrast, industry tends to do a pretty good job of this. If you go and you try to swipe your credit card in a gas station that you've never been to before, 100 miles from your house, there's like a 10% chance they're going to like block you and say, not so sure about this. Right? They're very good at using unsupervised machine learning and detection and being like, this is weird, and not paying. The government's in general much worse on this. Today, we're also going to talk about some pattern recognition style tools that look for signals of misreporting. I'll get into that later because that's really the focus of today's talk. And then I also want to say that the rise of machine learning technology has been very valuable. I have a paper on this as well, but there are some ideas that rather than just these red flags, are you 4 standard deviations away from the next guy? We can also just think about much more complicated, high dimensional machine learning for anomaly detection, where you look at the entire universe of people who've ever done anything and say, is there some reason that this looks like an outlier? And we can talk about that if we have some time later as well. Okay. So now I'm going to do something that's, oh, go ahead, Joseph.
Thank you. So I have a question concerning not exactly our capacity to detect or measure fraud, although maybe we can frame it that way. In your previous slide, you mentioned quite correctly this issue of, we're only seeing the patterns based on data on corruption cases or fraud cases, right? This is something that happened in both our areas. But we don't know what we don't know, basically, right? So our data by necessity is always biased, right? Especially
No, I think data that are trained on enforcement are biased.
right, right.
I have a paper that uses unsupervised machine learning to try to look at fraud in public Medicare data. Excuse me, in public health insurance data from the United States. And exactly, we don't do that. We say, look, we don't want to start with all the people who ever got caught
Hmm.
because that's a bias sample. Instead, we start with all the data on everything the United States ever spent money on. Every
Hmm.
inpatient hospitalization for a year, it's $100 million easily. Okay. And then we say, okay, who looks like their reporting patterns are different from everyone else in a way that makes them money?
Hmm.
That's it. Doesn't matter if you ever got caught. What looks different in a way that makes you money? And we use some modern computer science it's a very high dimensional problem. And so this is in partnership with some computer scientists at Carnegie Mellon. And we rank every hospital in the United States by how suspicious they are. Then we say, who got caught? And we compare the two lists. And what we find is that a lot of our top hospitals also have been got caught for fraud, which tells us that there's at least some signal in what we've done. But there are also a lot at the top of the list that have not. So it is possible to use what I'd call a set of unsupervised machine learning methods where you just basically say, this looks weird. It doesn't look weird because someone else caught it. It looks weird because they're making money and the behavior doesn't make any sense. And I'll talk about a paper today that also uses some unsupervised machine learning to do that.
Hey,
Now, that is a different problem. And the problem is you don't know if you're right.
right. That answers a big part of my question. Thank you so much. So you mean statistically unusual patterns, right? That can be detected independently from the training data that you may have available to you.
Yes.
Uh, but indeed, my question was going to be, right, you don't know until there's a forensic audit, I guess, following up those results, if what you're finding is just unusual because it's unusual and life is very messy, or if indeed we're looking at criminal patterns. Is that correct?
That's right. And so I would say that my papers sort of have one of two forms. Either we use supervised, right? We look at a bunch of people who got caught for fraud and we look at people who look like that. And we sort of start with the enforcement, or we go the other direction. We start with the data. But usually you want to do some validation in the latter case. In the latter case, where you're just starting with raw data, you then want to say, well, why do we think that this is fraud instead of so one thing I'll say from an academic perspective is your mileage may vary in terms of what journals are willing to accept, right? Some journals, particularly very good journals, are, the evidentiary standard is very high. And so you just want to be careful, so I saw a paper that got rejected by very good people at a very top journal very recently because they purported to show major fraud in a public program in a developing country. And the patterns were super weird, but they had basically no evidence to validate it. The journal's like, we can't, it's like almost libel. Like we can't run that this happened, right? And so, but it's a hard field for that reason. The flip side is I think referees and editors at journals do tend to be a little sympathetic because I kind of go like, look, it's fraud, they're hiding it. Like, yeah, but it's a great point, Joseph.
Okay, thank you.
Okay. So now I want to spend a little bit of time, not before I talk about the Kenya and the digit analysis paper, I want to spend time briefing you on 4 papers that have come out in top economics journals recently that I've written that I think are worth this community knowing about because they're about areas of anti-fraud policy that I think actually directly apply to ways in which we could advance anti-corruption policy. And I thought it would be, and I'm also going to spend some time talking about the detection mechanisms that those papers use. Okay. So I want to talk about a paper, which had been my job market paper. It's forthcoming in the Review of Economics and Statistics. It's a solo authored paper called Can Whistleblowers Root Out Public Expenditure Fraud? And I want to tell you a little bit about a law that the United States has, which is called the False Claims Act. The False Claims Act is a US whistleblower law that actually allows private anti-fraud litigation in the courts. If you know about someone who is stealing money from the US government, you do not go tell the US government. You go and you hire your own attorney and you sue them. And if you win, the government's going to get back up to triple damages and they're going to give you a cut of that of between 15 and 30%. Okay. So this is a very unusual way to approaching anti-corruption and anti-fraud because it is fundamentally privatization. Instead of waiting for the government to come in and figure out who's doing this, they say, look, if you know about this, we'll pay you. And whistleblowers have made about $4 billion in the United States since 1987 on programs like this. The government has recovered about $25 billion in settlements and judgments from these lawsuits. Okay. It's a super weird law. I took this. I ran a Freedom of Information request on the US Department of Justice. So I have data on every lawsuit. And I matched into our public healthcare claims data. And I said, what happens when whistleblowers sue healthcare providers? And what I found is the major finding here is that in addition to these large dollar value settlements where the government's getting back money, the government is also saving about 10 times more than that because the fraud stops happening. So a nurse or someone who works at this hospital figures out that the hospital is stealing money from the government. They go, they hire their lawyer, they sue. The lawsuit goes through court, and the government goes to the hospital and says, you owe us $500 million, which has happened many times. Not only does the government get the $500 million, the government also, on average, saves another $5 billion because of that hospital and a bunch of other hospitals who weren't party to the lawsuit stop doing it. They stop doing the fraud. And these prevention and deterrence effects are major. The idea is it's not just about who you catch. It's about scaring off everyone else who's doing the same conduct. And this is actually very effective. And so this paper discusses not only the sort of data and the measurement, but also the economics of the law. Why do we pay whistleblowers the amount that we pay them? Should we pay them more or less? How much does it cost the government? These sort of questions. And so if you're interested in this, it's available on my website. It's an interesting paper, and it's a very weird system. And so the reason that I thought that might be interesting to this group is because I think there are some open questions in the field of corruption about how we can effectively use whistleblowers. Whistleblowers, we think, are generally a positive way of dealing with corruption as well as fraud. Here, we're actually just like turning them into private little bounty hunters. And it's kind of a fun way that the US deals with it's a very niche program. One point is, how in this paper do I measure the fraud that went down? The benefit of having the legal data from the people who sued in court is that they're required to say, here's what the fraud scheme was, here's where you can go find it in the claims data. And so there was this very laborious process I spent like most of graduate school doing, where I would like go and read hundreds of pages of whistleblower lawsuits and then say, oh, it looks like this billing code should show up, and then go into the public claims data. It's public data, but you need a data use agreement in order to access it, and say, how much money were we spending on that? How did that evolve over time? And a lot of this has this sort of before versus after. The whistleblower came in on this day. Oh, wow, we spent a lot less money after that on these sort of services. Any questions on this paper before I move on? Yeah, go ahead, Joseph.
Yes, so I was also thinking, I mean, you didn't necessarily frame it explicitly that way, but it sounds to me that besides detecting the scope of the fraud, in this case fraud, we're also talking a lot about costing fraud, right? So estimating that the cost not just based on the amount of money that was detected that was involved in this specific organization, but as you said, because it has a ripple effect.
Yeah.
By looking at before and after, specifically after that whistleblower case, we can also estimate, okay, during this year, this was the amount of fraud that was taking place, right? This was the amount of money that was being lost, which is quite interesting. And I bring it up because in anti-corruption, right, when we talk about measurement, right, very often people talk about, okay, that means how many people are involved in cases of corruption, or how many cases of corruption, or how many organizations are affected. But, the question of how much money is being lost is like, there's some numbers being thrown around, but really we don't know. There's not enough effort really going that direction. So I find this very interesting.
Yes. So if you're interested in, it's not listed on this slide deck, but I was commissioned by the Centers for Medicare and Medicaid Services, which is the US public health insurance oversight arm, to write a white paper for the government answering exactly this question, which is like, okay, how do you put numbers on these things? And fundamentally, one of the problems is you're actually asking a counterfactual question. you're asking how much money did we save, which is equivalent to how much money would we have spent if we didn't catch this thing, which is a counterfactual question. And it's hard. And so I go through like, here are some ways that you can do bounds estimation on this. It's a lot of like, you could do a linear projection, you could make this sort of conservative estimate, et cetera. It's available on my website. It's called Measuring the Value of Anti-Fraud Efforts. And it's a white paper that the government published. And so, but it's super interesting. And one of the problems that arises here is, where do you scope the market? Do you want to look at only the person who got caught and how much they were spending? Do you want to look at everyone in the whole city, in the whole region, in the whole country, the whole service, et cetera? If you zoom out too far, you sort of lose your signal to noise. If you zoom in too close, you sort of miss the spillover effects. And it's really tricky. Go ahead, David.
Yeah, thank you very much. My name is David, Osaka University. I'm a research fellow at Osaka University. I'm working on anti-corruption. You have actually touched on my question with answering Joseph's question, but I still want to know a bit more about this policy that you just described in the US. What sort of support does the state provide for an individual that want to prosecute, because if you are saying that an individual is just supposed to know of a fraud or a potential fraud, then decide to go to court, and then it needs some sort of investigative,
Yes,
kind
great. I'm
of
happy to
police
answer.
power for you
It's a
to
great
for
question.
you to be able
Great question.
to do some of these things.
So when the whistleblower files the lawsuit, they send a copy to the US Department of Justice, who are the attorneys for the government. The government, and then the case is filed under seal. That means it's not public, and they actually don't tell the defendant. The government it's supposed to be 60 days. In practice, it's more like 2 years. The government takes about 2 years, and they decide, do we think that this is worth our resources or not? And then they make a decision that's called intervention. Either the government joins the case, in which case the whistleblower and the government are now the prosecutors versus the defendant. And then the government brings a lot of investigatory power. They can do subpoenas, they can do raids, they can like lots of great stuff. But there's also the ability for the government to what's called decline the case and say, we don't have the resources for this, but you should keep going. And then the whistleblower is allowed to proceed with the litigation without the government's help. So under the False Claims Act, what happens is if the government joins the case, the whistleblower is entitled to between 15 and 25% of the recovery that the government gets at the end. If the government declines the case, the whistleblower gets more money. They get between 25 and 30% because they had to do more work. So it's a very weird law. There's data available, and I actually have case level data. If anyone ever wants it, I'll email you the spreadsheet that I got from the government about how much did the whistleblower get? Did the government join the case? How long did the government wait before they joined the case? In general, and there's a table in this paper here that shows descriptive statistics, you really want the government to join the case. The government, when conditional on the government joining a case, they win like 95% of the time because they can just pick the really good cases. And then they throw the weight of the entire US government behind it. But lots of cases get declined, and only about a third of cases result in any recovery for the government.
Oh, a third is actually a very good number, actually. But I would like to have a good dive into the paper anyway, so you can share the paper.
Yes. These are all available ungated. They're all in journals, but they're all on my website. If you click, there's a copy. Great. I want to now move on to another paper that I think is worth talking through with this crowd, which is called Ambulance Taxis. And this paper will come out later this year in the Journal of Political Economy. And it is a case study of a very specific fraud, but really ultimately it is about law and economics. Okay, so the United States has a program for patients that are on dialysis. Dialysis is when the patient's kidneys no longer function and they need to go to a center 3 times a week to get hooked up to a machine or they die. And it's a very intensive service. And fun fact, actually 1% of the US federal budget is spent on the dialysis program. That's not 1% of the health budget. That's 1% of the entire US federal government spending is spent on the dialysis program. It is ridiculously expensive. There are about 500,000 of these people. Their kidneys don't function. And if they don't get this care, they die. They are responsible for getting themselves to and from their clinics. The government does not have a transportation benefit. It's just where we've scoped the public program. look, we'll pay for all the services, but you got to get yourself there. And if it means you ride the bus, but they have a little asterisk that says, unless you're bedridden, if there's no other way you could get to the center except in an ambulance with oxygen, of course, we'll pay for the ambulance. And so what happened is organized crime in the United States figured out that nobody was ever checking whether these patients actually needed the ambulance. You just had to say, yep, the patient's bedridden, and then the government would pay for it. And they were paying way too much. They're paying about $250 for a one-way ride. And this is a non-emergency ambulance, no lights and sirens ride. And organized crime in the United States realized, well, if we just open a new ambulance company, it doesn't even need to be a good ambulance. These people don't even need it. And they would basically get a van and write the word ambulance on it and go and pick people up around town and get $250 for every person that they brought to their dialysis appointment. Not only that, you never get off of dialysis until you die. These people are going to go to and from the same center 3 times a week for the rest of their life. That's $250 each way. That's $500 a visit, $1,500 a week, $6,000 a month, $72,000 a year per patient, just for taxi rides. Okay? This blew up. The United States government spent $7.7 billion on this program. It was not meant to be a big program. Okay? We find 3,000 companies provide rides like this. And the data, the qualitative data on this paper are ridiculous. I mean, we're talking about the Russian mob. We're talking, they would catch people and then their family members would go open a new ambulance company the next day across town. They would bribe the beneficiaries. They'd pay them $20 to ride in the ambulance because they were getting $250 from the government. Really juicy stuff. So the government used 3 sets of tools to try to stop this behavior. The first thing they did is they ran these whistleblower lawsuits that we just talked about, the False Claims Act lawsuits. At some point, they also started trying to put people in jail using criminal enforcement. You're allowed to, prosecute these people criminally. You bring them to court, you arrest them, you bring them to court, you indict them, you have a trial, and then you send them to federal prison. And then finally, the government said, enough is enough. We just can't keep doing this. We're not going to pay anyone for these services until you have a note signed by a doctor saying that this patient is medically necessary. They're bedridden, they need oxygen. There's no way that they could get to the dialysis clinic safely. Okay? In this case, what we're going to be able to look at, what is fraud here? We're going to be able to look at just spending on the service, spending on non-emergency dialysis ambulance transportation. We're also going to be able to say, when people stop getting these services, do they end up missing the appointment? Because we can see whether or not they had the appointment. Do they end up having increased hospitalizations because they didn't go to their appointments? Because if you don't get dialysis, you go to the hospital eventually. And did the patients die? What's really nice from a measurement standpoint here is the rules are so clear that measuring the fraud is actually very easy. We can just say, did you get the service? And if you didn't get the service, did you still make it there? Because the rule is if you can make it there, you weren't eligible, right? Okay. So here's kind of the takeaway of the paper. This is a difference in difference graph of 3 different rollouts. So we look at in different parts of the country when we first started doing these lawsuits, these whistleblower lawsuits, in different parts of the country when we first started doing criminal enforcement, and then in different parts of the country when the prior authorization regulation was rolled out. And this is in log payments. And so -1 log corresponds to about a 67% decrease. Okay. What we find is that civil enforcement here was useless, didn't do anything. Criminal enforcement caused about a 20% decline in spending. And prior authorization, that's the paperwork, caused a 67% permanent drop in spending. We then go and do a lot of stuff. How many firms stayed open? Were the patients sicker? We find no evidence that any patients were harmed by prior authorization, even the ones who were writing most frequently. No missed visits, no increased hospitalizations, no mortality. Okay. So we think about this as ultimately being a law and economics result. Why is making people sign the paperwork up front more effective than going after them in court? And the answer is ex ante versus ex post is right, the way that we think about this in law. Civil enforcement and criminal enforcement are ex post measures of trying to stop fraud. You go out and you wait till the fraud has already happened and then you go try to fight it. Sometimes we call this pay and chase. Let it happen and then we're going to try to catch them on the backside. The issue is when you have small ambulance companies and thousands of them, you can't get the money back and you can't catch everyone. Why? Does anyone here know what a used ambulance costs? You can buy it on eBay for $20,000. I just told you they're getting $250 a service. These things pay off in like 3 weeks. Okay. You go to these companies, the money's gone. They've offshored it, they've spent it, it's gone. So you file a civil lawsuit against them and they lose and they say, yep, we owe you $2 million, and then they never pay. And so of course it doesn't have any effect when you catch them. Criminal enforcement's slightly better because at least you can put people in jail and like you can always enforce those penalties even when there's no money left. But not really effective because you can't go after everyone. We do some calibrations. It's like 3% chance of getting caught. Prior authorization takes care of this because you don't send the money out. And so you don't have to worry about how am I going to get it back. Go ahead, David. You're muted.
Yeah, David, go
Yeah,
ahead.
isn't prior authorization, wouldn't that be some sort of unintended consequences, probably increasing the number of eventual casualties or
Yeah,
deaths?
so that's exactly what we worry about. So two things. The first is we do some work to try to figure out how hard was it to actually do a prior authorization. We think it cost the ambulance company something like $30 a patient. They have to fill out a form, they have to get it signed by a physician, but the nurse kind of does all the work. And thinking about how much we pay them and their time, it costs $30 to $50 a patient to do the work, which means that it's not a huge barrier, but it's really that the physicians aren't willing to sign their name and say this patient's bedridden if the patient isn't. Doctors have a lot more to lose. They have more skin in the game. They have a license than these ambulance companies. The second piece, though, is that we can actually measure this, David. We look at patients who rode in ambulances when prior authorization rolled out, and we can follow them. We can say, did they die? We have the data. We know their death dates. We know every hospital they go to. We know every clinic they go to. Actually, there's no effect. Precise zeros. We were really worried about this. This is the exact question, which is like, you're just going to make it really hard for people to access medical services. Aren't you going to kill people? Actually, no. Empirically, zero. Go ahead. I think there was a question from, was it Daniel or Paul?
Paul.
Paul.
It was me, but you already answered because I was thinking that if organized crime is truly organized crime, then the doctor just become another subject to bribe. But you answered my question already. They have skin in the game, and I imagine, yeah. Thanks.
Right. Okay, sorry to keep going through a set of studies, but I think that there are some lessons here, especially about measurement. And I think these are work. Okay, so this paper on hospice fraud I just published in the American Economic Review at the beginning of this year. And so I thought that this was worth sort of a cautionary tale. Okay. Hospice is the United States program for patients who are close to death. And the idea is, and England has this, and this is common all over Europe. I think Japan has a hospice program as well. This is a really common thing. And you say, look, if you're going to die and you don't want to spend the end of your life running to and from the doctor's appointments, we'll send someone to your house and they'll fluff your pillow and they'll bring the pain medication and you can die comfortably at home. Okay. In the United States, between 1999 and 2019, the number of companies doing this that called themselves for profit went up by 4x. Why? The hospice program pays about $200 a day for companies to go and do this. And so this became very profitable. And as the rise in these companies grew, they started taking patients who looked a little bit less appropriate. And so instead of taking someone who has terminal brain cancer and clearly has 3 weeks to live and going and fluffing their pillow, they would take an Alzheimer's patient. And Alzheimer's patients can live like a really long time. And so you're only supposed to qualify for this program if you have 6 months or less to live. And they started taking people who like very clearly didn't have 6 months or less to live. Okay. We do a few things in this paper. One of the things we try to show is what happens when the patient goes on this program. Not really a fraud question, but we also try to figure out what happened when the government finally decided that this was fraud and prosecuted it. And so we study both the effects of patients going to hospice, particularly for-profit hospices, as well as the effects of trying to stop that behavior. And we had this super surprise finding that I think is really interesting because it's super related to corruption research. The fraud saved money. Why? The fraud saved money because getting fraudulent hospice care which is where someone comes to your house and fluffs your pillow and gives you pain medication, is actually way cheaper than driving patients to and from hospitals and going to the nursing home and having them take expensive pharmaceuticals. And the patients were super happy to do it. The patients wanted the service. They really were happy. They're like, I have 9 months to live. I don't care that I don't have 6 months to live and I don't qualify. I don't want to do all these hospitalizations. And so what's amazing here is that we have a case here that exactly parallels old corruption research. Have you guys ever seen a paper that said there was corruption, but it was efficient because it greased the wheel? This is a very common result in corruption. We say like, yeah, okay, there was some bribery, but like it made the public services actually work in a way that they weren't working before. This is one of those kind of papers. What happened here is we have a stupid rule, which is you're only allowed to get this service if you have 6 months to live. Oh no, but if you have 7 months to live, you can't get the service. Well, the fraud here was like the greasing of the wheel, right? It relaxed those constraints. And so we're actually able to show that there's this parallel between our fraud research and this corruption research, which is that actually it saved money. And like it's just because it ended up being that the rule was inefficient. And so breaking that rule had this efficiency gain. It's a very weird result, but I thought that this was something worth talking about. Go ahead, Joseph.
Thank you. What you just said is really, really interesting, and it made me think back to what we were saying a little earlier about costing of fraud and corruption. So basically, this means that we can talk about the amount of money being involved in fraud, but actually, if we talk about those numbers in terms of waste, there's less waste because there's a little more fraud going on.
Sometimes. I would
No,
say
of
that
course.
this is
I mean, in this specific case.
That's right. So right, that's right. So this is it's an unusual case, but it's not impossible. And so one thing that this points out is that fraud and corruption are legal standards. They're not welfare standards. We don't call something fraud because it's necessarily bad. We call it fraud because it's illegal. We don't call something corruption because it's necessarily bad. We call it that because it's illegal. Now, most of it's bad. Like 99% of it is really bad. But we have to learn to do this. What Joseph said is something that an economist would call general equilibrium. You don't just want to look at the thing that we targeted, how much did we spend on that, et cetera. You have to think about the whole system, right? It turns out that if paying a $5 bribe to the DMV makes it so that they hand out 1,000 more driver's licenses, there are moral reasons we think that's probably bad, right? But like it's not unclear. It's not clear that it's inefficient. Make sense? And so one thing that I want to point out is that as we think about measuring corruption and fraud, you want to zoom out and say how much money is being spent overall. Usually you're going to find that it's too much, and usually you're going to find that anti-fraud saves money, but occasionally you can find that fraud or corruption schemes have an efficiency. Go ahead, Dina.
Thank you. This is, as you say, a classic, and we see this a lot in our work in low-income countries, where the official systems are usually don't make sense. So people, when they break them, they actually do things better. So we see that, but at the same time, it's really difficult in terms of defining solutions, because one of the problems that you discovered, and we call this in health systems, we have something called systems thinking. We look at unintended consequences and whether there are various methods like systems dynamic modeling or various ways, but very imperfect ways, not good ways, to think what each anti-corruption policy can do, because in some cases it can make things better, in other cases could make things worse, in other cases could generate adaptive behavior, so you could mushroom more forms of initially could work, but then it creates an opportunity for different types of corruption.
It's a wonderful point. It's a wonderful point. So what I would say is the problem here is the rules are bad. The problem in your case is the systems are bad. Fraud and corruption are, in general, poor ways of solving that. It would be much better if we just fixed the original system. It'd be much better if we fixed the rules and made it so that people who have 9 months to live can go to hospice, and then we don't need to commit fraud, right? It'd be much better in your case if the official system just started working, right? So I don't think of this as a long-term solution. We don't want a world in which the government performs so badly that everyone just needs to be corrupt in order to make the system work. So in some sense, what you point out is like these are short-term solutions, but ultimately, right, the systems thinking says, well, actually, we need to change. One thing that I can actually think about, though, as a follow-up, which is really valuable, is in this case, corruption and fraud are almost like experimenting with the rules. Right? If we think about ourselves as social scientists, one thing we'd love to see is if the government allowed us to occasionally run experiments. So what's the optimal experiment here is, some people are allowed to go to hospice at 6 months and some people are allowed to go to hospice at 9 months of life left. They're not going to do that. They might do it. I'm talking to the director of Medicare Innovation. Actually, I might even get him to run that experiment, but mostly they won't do it. Okay. In your case, it's very hard to say to the government, we're going to have two systems. One in which you wait in line for a permit, and one in which you buy permits on the open market because you bribe someone. And we're going to see which one has better allocation. They're never going to run it, right? They're never going to run the system. But what we can learn from the corruption, right? Breaking the rules is like experimenting with the rules. And so if you find that actually the bribes are meaning that the highest value buildings were getting built first, which might be efficient because they got to the front of the line, you might want to formalize that as a process and say you can pay an official fee to the government of an extra permit amount for an expedited process. And you don't have to bribe anyone. And we actually learn from this, right? So, Dina, I think you make a fantastic point. You have a follow-up there, Dina, or should I keep going? Okay, great. Last paper of mine before we dive into Kenya that I wanted to highlight because it
Sorry, I just want to follow up actually. One thing that you said in terms of formalizing, I wish it's possible, but of course we have the governance and political will and changing governments every 2 years and the corruption in government, which they don't care what's better because they just. But one thing that we that there is a branch of health policy research, which is actually not linked to research, but we're quite curious how it could apply. It almost presumes that even if you change the rules, something else would come up. So they call it everyday resilience. So to make the system more self-adjusting at the level of the organization rather than always waiting for national policy. But anyway, just a point.
No, it's a very good point. Yeah. In this case, it would require an act of the US Congress to change these rules. So despite having a paper showing that it saved a lot of money and published in the top econ journal, we can't, and my co-author in this paper is John Gruber, who was the person who designed the Affordable Care Act in the United States and was the Deputy Assistant Treasury Secretary. We can't get it passed. It's just like, so you're right. Like sometimes the government just doesn't work, Okay, great. So last paper that I think is interesting. Here I discuss the unemployment insurance program. Throughout the world, during the COVID pandemic, governments handed out huge amounts of money through unemployment systems to try to keep economies running. I don't know if you guys are familiar with this, but there was like massive fraud in a lot of these programs. This is true all over the world. I saw a paper about this in Indonesia. We know that it was the case in Italy. And in the United States, there's been some done on the small business programs. Ours is the first to look at the program during the pandemic of unemployment insurance. The basic idea is the government was giving people extra cash for unemployment during COVID. We have a very interesting a set of data here and an interesting measurement point that I thought would be worth discussing quickly, which is we got data from the financial system. This is a very unusual data set that I don't see a lot of corruption researchers working with, but we were able to get a financial services provider in the United States called Factious, where when you swipe a debit card, when you swipe a debit card, like a lot of things happen in the background on computers and then someone gets paid. One of the steps goes through this provider that sells a copy of the data. And we were actually able to get data from 1% of all US debit cards. We look for money that was paid onto those debit cards by state unemployment agencies and then how the money was spent by the beneficiaries. And what we're able to find is that there is a set of beneficiaries who get way too much money and then they take it all out in cash very quickly. They are getting thousands of dollars from the government, and then they're running to the ATMs, and they're taking it out, and then they're going to the next ATM, and they're taking it out, and then they're going to the next ATM and taking it out. We have timestamps. It's transaction level data, okay? What was actually happening in the United States during the pandemic was it wasn't like a lot of individuals trying to defraud the government. There was some of that, but it was a lot of organized crime would go on the dark web. They would buy people's identity numbers, and then they'd apply for these benefits all over the country. And then they'd get the money on these debit cards from the government and they'd take it out in cash and then ship it overseas. And so the relevant policy here was that finally, in the middle of the pandemic, the United States started doing identity verification using a smartphone app where you had to prove who you were in order to get the money. You had to take a selfie with your identity card and your face. This was rolled out in different states of the US at different times, which we love as economists because then you get variation, identifying variation for our regressions. And we show that this was actually very effective at stopping the fraudulent behavior. We see about a 30% drop. One thing that we do in this paper, and I'd encourage you to go look at it if you're interested in machine learning for this stuff, is we have this huge data set where we can see when you got the money, what you spent it on, how much you spent at the grocery store, how much you spent at the liquor store, all of these, how quickly you went to the ATM, et cetera. And we run a big unsupervised machine learning algorithm. So we have no labeled data here, Joseph. We have no idea who got caught for fraud. We just look at anomalous behavior and show it went down. Now, you point out we're not sure that that's necessarily fraud. It could be people who just got a lot of money and really like cash. Hard to buy that. But we are getting beaten up a little bit by referees at journals who are like, well, you can't really prove this is fraud. So, your mileage may vary. Okay, on to today's main paper for our remaining. I want to spend the rest of today talking about a single paper because it is really a measurement paper. And so everything I've talked to you about so far has measurement components. Here are where the data come from. Here's what you can and can't do, et cetera. But I have a paper coming out in Rural Development next month with Gene Ensminger from Caltech, who's a sociocultural anthropologist, about a World Bank project in Kenya. And so I apologize. I would say I've glossed a lot of institutional details and policies really fast. I'm going to get really deep here so we can really talk about this, okay? So the World Bank runs development aid projects around the world, generally paid for by governments. In this paper, we look at a $225 million community-driven development project in the arid lands of Kenya, called the Arid Lands Project. In response to a whistleblower report, the World Bank conducted one of its only ever forensic audits on this project. After a lot of the money had been stolen, and found that 66% of the transactions were suspected fraudulent or questionable. 66%. They required the government of Kenya to repay a bunch of money, which, if you know anything about the World Bank, they really never do. They published a forensic audit on the integrity vice presidency of the World Bank, and we demanded that they give us all of the transaction level data. Okay? The question here is a measurement question, which is there a way to just use the data to get these signals without running a forensic audit? The forensic audit here was nice, but you can't run a forensic audit on every project. They're very intensive. It's also really hard to run a forensic audit in the rural arid lands of Kenya. Why? Here's a receipt that says that we paid for lunch for 23 villagers. Here's a list of their names. They're nomads. Good luck finding them and verifying whether or not they were there. Right? Here's petty cash that was spent on fuel, right? For a truck that ostensibly drove, right? It's impossible to do a lot of this forensic auditing stuff, okay? That's true in general, right? We have a figure in the paper that's not on the slides. 92% of aid flows to countries that have below average corruption scores. Why? Because it goes to the poor countries. That's where the aid is needed, right? So most development aid is going to countries that have, in general, poor anti-corruption controls because they're also the countries that are least developed. But that poses a problem because we need protections. The second thing we point out in the paper is that largely the World Bank and USAID do a very poor job of investigating their own frauds. Why? The World Bank doesn't want to come out and say tons of our money gets stolen. It's like a political non-starter for them. What are they going to go to the US government and say, by the way, a lot of the money got stolen? They're never going to get funded, right? And so the aid organizations don't really want to open the transparency door and say how much of this money is being stolen because they only stand to lose from that. Okay? So there's a lot of fraud in development aid. The goal of this project is to say, how can we detect and measure it without forensic audits? Okay. So the Arid Lands Project, World Bank project, was a large-scale community-driven development project. The idea was generally infrastructure, goods and works project, livelihood support, environmental conservation in the drought-prone regions of Kenya. The budget was somewhat over $200 million. It was implemented in 11 of the arid and 17 semi-arid districts of Kenya between 1993 and 2010. We focus on the arid districts because that's where we got the best data. They did a lot of stuff. Teaching people to farm better, building wells, building schools, training, stuff like that. And as I mentioned, there was this forensic audit that was conducted in response to a whistleblower report that found huge amounts of fraud and systematic reporting. A lot of this actually has to do with the 2008 Kenyan presidential election. In 2008, there was a Kenyan presidential election that was widely believed to have been stolen, and we're going to show that there was a lot of fraud that appears to have happened specifically in 2008. And so we think a lot of the World Bank money ended up flowing into the political coffers and was therefore used to help steal the election. Kind of a running theme here. Okay. How do we actually detect fraud? I'm going to talk to you about something called digit analysis. Here's the basic idea. People can't make up numbers very well. If I were to take you, anyone in this call, and sit you down with a piece of paper and say, write down 100 numbers, random numbers, you would not be able to do it in a way that I could not detect. I would be able to detect the difference between you and a machine every single time. People can't do it. Can't do it. There are a lot of patterns that people put into the numbers that they falsify. And those are different from the patterns of the real world. And the driving phenomenon here is actually this idea called Benford's law. Benford's law gives the distribution of numbers in real world data, and it's not every number evenly. It's not every number equally. When you look at a number, you have different digit places. Like the number 1,530 has 4 digits. The first digit is 1, the second digit is 5, the third digit is 3, the last digit is 0. We can also think about that as the ones place, the tens place, the hundreds place, and the thousands place. Benford's law tells us that you're more likely to see a low number at the beginning of a number. The probability that the first digit is any number is log base 10, 1 over 1 plus that digit. I'm going to show some graphs here. Sorry for the formulas. But it also defines the pattern of multiple numbers. And so maybe it's easier to see like this. In the first digit of a number that occurs in naturally occurring data, I'll talk about what I mean by that in a second. The first digit is 1 about 30% of the time, and the first digit is 9 about 5% of the time. When you look at the second digit, that's a little bit closer to even. It's a low digit, more than time. It's a high digit, a little less than 10% of the time. Okay? Book of scientific, if you open a science textbook, this is what you're going to find. The numbers all follow this. In physics, in river lengths, in population demographics, in finance, you're going to see this pattern all over the place. Super interesting phenomenon. Okay? Now, historically, this has been used sometimes by forensic auditors, but accountants are not the most amazing statisticians on average, and they've historically done this in a very underpowered way. They'll like look at only the first digit or look at only the second digit. And what we do in this paper is we really juice up the statistics, okay? This is a table of what the frequencies should look like. So the columns are the digit place and the rows are the number. And as we mentioned, in the first digit place, it's like 30% ones. 0 can't be the first digit. 30% ones all the way down to 5% nines. By the time you get to later digits, they're about even. So by the time you're at the third or fourth digit, it should be uniform. So when you look at the last digit of a long number, it should be equally distributed 0 through 9. Okay? Why? There's a lot of reasons for this, and mathematicians have published some very interesting papers on this, but the only intuition that's ever really stuck with me is the first bullet point here, which is a piling up effect. Why would we get more ones in the first digit place than nines? Well, to get from a 1 to a 2, you have to double a number. But to get from an 8 to a 9, you only need a 10% growth. And so to get from a 9 to a 1, you only need an 11% growth, right? And so in general, incrementing it just works out that the numbers sort of pile up in the low numbers because of this phenomenon. 1 million to 2 million is a much bigger jump than 800,000 to 900,000, right? Okay. So there's also some other things that lead to Benford's law. This is one of these things that's like everywhere once you've seen it. In particular, financial data follow Benford's law because you're taking a bunch of numbers, you're multiplying them together, and then you're summing them, and that process creates Benford's law distributions. Unless the data are subject to caps, the data should be picked by humans, like prices or check numbers or some sort of like machine generated numbers. So you have to make sure you cut those out of your data set. But when you're left with like, we ran a training and we spent $20,435, if you have enough of those data, you can tell whether the data were made up by a human or whether they were really truthfully reported. Great. In this paper, we go through a set of tests, including existing ones like look at the first digit, but also more complicated ones that we came up with. And so I'll show you how this works. If you look across all of the arid lands districts, in the first digit place, it actually follows Benford's law. The gray bars are the observed, and the black is what Benford's law predicts. Not statistically significant. Great. These data should be following Benford's law. However, sometimes you disaggregate regionally or by different sorts of projects. And for example, in Ijara, which is one of the arid districts, like they're way overusing 2. All of the tests I'm going to run here are very simple statistical tests. This is a chi-square goodness of fit test. You can run this in Excel, right? Like it's the math isn't super hard, okay? So we go through and we do a battery of tests that we discuss in the paper to check whether the data look valid. And one thing that we discovered, and this is a fun one, you guys will like this. This is not about Benford's law. When people write down their own numbers, they underuse what are called digit pairs. If you write down 5 numbers and I say make them look random, you're going to write down 19764. But it turns out that 10% of the time, you should be writing down 66 or 55 or 44 or 33. And people just won't do it. It doesn't look random enough to us. Humans underuse this digit pair. If you have someone write down a bunch of random numbers, if any of you teach, you should make your student do this. Have them write down a bunch of random numbers, and they'll never do the digit pair. This has been like replicated in a lot of lab studies. They just don't do it. And when we look across districts, here we have each bar is a different district. Almost all of the districts are using 4 or 5% digit pairs when they really should be using closer to 9% digit pairs. Except one of them suddenly was doing way too many of them. And so one thing we do in this paper, we show like, even if maybe it shouldn't be exactly what we think, there's no reason these districts should be different from each other. And so we also have this regional variation that's very suspicious. Okay. This study is really about improving the statistical methods of digit analysis. The last 2 things I've shown you have appeared in papers since the 1960s. Okay. But, go ahead, Joseph.
Yes, we have a question from Daniel. I don't know if Daniel prefers to just ask it himself. But he wrote here in the chat, the price of services or goods.
Sorry, I mistyped. So basically, the prices of services or goods follows a different pattern. It's just an example that they very often end in 00 or multiple zeros or 99 or 50 or whatever. That's all.
So I alluded to that here. Benford's law does not apply to data that are picked by humans. None of this stuff applies to data that are picked by humans. But when you get transaction level data, generally you don't see prices. You see, we bought lunch for 25 people and we spent $1,040.33. The prices are implicitly there, but they've been multiplied by quantities and then added together. And we show in the paper using simulations that you can start with data that do not follow this, like lots of, manipulate. And then if they're the prices can be picked. But when you multiply them by quantities and you sum them, you actually get back to Benford's law. So Daniel, you don't use this sort of analysis on the price data. You have to use it on the transaction data. Okay. So the main contribution of this study are 2 new statistical tests that are designed to improve the statistical power. When I show you this table, the way that forensic auditors for years have used it, if they said, okay, I'm going to look at the first digit and I'm going to compare the values to this column. I'm going to look at the second digit and compare the values to this column. I'm going to look at the third digit and compare the values to this column. And that is underpowered. What you should actually do is you should look at the full distribution of all the digits and run a chi-square goodness of fit test, 2-way chi-square goodness of fit test to all of these numbers. So you should be simultaneously testing the first digit and the second digit, etc. In our paper, we show that sometimes you only want to go second onwards. Sometimes it's hard for people to manipulate the first digit because the first digit, like maybe they don't want to double the amount, but they're happy to scooch in on the second digit. But we basically show that if you look at all of the digits together, you get much better statistical power. And that also allows you to do more breaking out across different regions. So we have 11 different regions. We want to be able to look within a region. That would really restrict your sample size. But by looking at multiple places of the digit, the first digits, the second digits, the third digits, all at once, you improve your sample size. And what we find is that, so this reported two forms of the transaction data. We see how much money they spent and also how many people they say they served at the same time, beneficiaries and participants. We find very consistently that they overuse even numbers. And there's no good reason for this. They are reporting transaction data that includes too many 2, 4, 6, and 8. We've removed zeros and fives from this analysis for rounding because sometimes there are legitimate zeros and fives because things get rounded. Kenyan shillings are worth like a US penny. And so there's legitimate rounding. And so we analyzed the zeros and fives separately in the paper. Just check on that. But so 2, 4, 6, and 8 are here, 2, 4, 6, and 8. So we see a heavy overuse of 2s, 4s, 6s, and 8s. One of the reasons we think this is going on is because in many circumstances, they were starting with a total and then fabricating numbers to add up to that total. Oh, we had 100 participants, 44 men, and 56 women. And it turns out that if you're going to do that mental math, it's easier to do it with even numbers. And so we think that this leads to an overuse of even numbers. Okay. The second thing we do, which is brand new, is, and this is a little complicated, Benford's law tells me about the first digit and the second digit and the third digit. Those are from the left. In the number 105, 1 is the first digit. In the number 1 million, 1 is the first digit. Benford's law is about the first digit, but those are really different numbers from each other. And so we do a little bit of math in the paper to show that actually you can look at it by the dollar value of the digit. Is it in the ones place, the tens place, the hundreds place, the thousands place, the 10,000s place? And then we say, correcting for Benford's law, do we see higher numbers showing up in more expensive digit places? Because the number 15, if you turn that number into 95, okay, you made some money, but it's way less valuable than if the number is 10,000 and you turn the number into 90,000. So we should see more manipulation when that first number or second number is worth more money. And we show in the paper that we do. The World Bank data show high inflation in the 10,000 and 1,000s digit place. And we do some simulations to show that that wouldn't happen in real Benford data. Okay. So when we break that same thing out by year, 2007 is when the 2008 presidential Kenyan election was happening. We find that this is really a phenomenon that was going on during the campaign. So this is really a measure of how much padding, we call this our padding test. How much extra money are they getting in? Are they turning the 3s into 5s, right? To try to get more money in the thousands place and in the 10,000 shillings place. This was really, in black, you see the values for 2007. This is really a 2007 phenomenon. Okay. We go through a bunch of different tests. We talked about first digits. We talked about padding. We do a bunch of other stuff too. And then for each of the different districts of Kenya, we subject this to a test and we write down the p-value. These are all p-values. And then we say, did you fail the statistical test? And we correct for the fact that we're doing thousands of, like a lot of tests. So our significance threshold is very conservative. I think it's 0.001. It's called a Bonferroni correction. And then we say, who failed the most tests? Which districts appear to be manipulating the data more? And when we compare that to the forensic audit, something really striking comes out, which is that the areas of Kenya, so here are all the regions, here's our failed tests. Here on the right are the suspected, fraudulent, and questionable from the World Bank Integrity Vice Presidency forensic audit. These districts were not audited at the bottom. They only did these ones. Okay. What we find is that our measure statistically significantly correlates with the forensic audit. That is, the areas of the country that show more manipulation under our patterns are the areas where the World Bank said that the data were more heavily manipulated. This means that instead of running a forensic audit, you can use our statistical tests to get a reliable signal of how much fraud is going on. Okay. Second, you notice that there were areas of the country that had high levels of failed tests that did not get audited. Why? There's a problem in audits, which is you start somewhere and you don't know who's the worst. So our method also says you can use it to guide the audits. Even if you don't want to just rely on our method, if you run our method first, before you run the audit, you can figure out who looks worst, and then you can go audit the most bad performing areas. Okay? So the goal of the paper is to say, we don't expect anyone else to go out and run a forensic audit on a digital analysis project. That's not a research endeavor. That's like a major World Bank thing that they managed to do. But this one-off tells us that actually you don't need to. You can just use the patterns of the reported data in order to do this. So we have a package out. If you guys are interested, it's on R. It's on my GitHub. You can go download it, and it runs these tests. R is a little finicky, and R keeps changing the dependencies. So if you get stuck on it, email me, and I'll help you debug. But it runs, all these graphs are produced by my R package. You can go and get these tests, are all built for you. They also do the processing of the data and stuff like that. So if you're interested, the packet's called Digit Analysis. It's on R. Okay. And it's available in the paper. It's linked in the paper. So we think of this digit analysis as one component that could have broader implications and applications in other areas. Obviously, development aid agencies aren't continuously running forensic audits, but they could be continuously doing this. It's really not that hard. They could be demanding data from their projects and then just subjecting it to this battery of tests. One thing that I often get asked is, well, if you tell people how you're going to test it, don't you think they're going to just get smart and stop manipulating the data in a way that's testable? I have a result that I've never published, which is basically I don't think so. And the reason is that you have enough different people who all have incentives to cheat. It's very hard for them to collaborate to get the right distribution because it would mean not cheating. It's like a tragedy of the commons kind of result. Okay. This also says that all you need to do is make the data transparent. You actually don't need to run these big, expensive field forensic audits all the time. If you make the data available, academia, civil society, the bank, the US government who funds 25% of the World Bank, or the European Union, which funds another 25% of the World Bank, could be doing this work instead, right? Beyond development aid, we think that this is going to be useful for all sorts of things: election monitoring, scientific fraud, corporate finance. It should be built into AI systems. There are a lot of things you want to do that are beyond digit analysis, but this is another signal that could be useful in a machine learning context. And obviously, we talked a little bit about this, but we think that this is relevant, particularly when it comes to kind of questions and concerns about democracy. Okay, so summarizing from everything I've said today, and then we'll open the floor to questions. I think that there are some interesting policy directions. I mentioned earlier that I have a paper that tries to use unsupervised machine learning. We didn't talk about it today very much, but AI-driven fraud detection is getting better. And so in addition to this digit analysis stuff, I'm also thinking about the sort of computer science question. In general, I think making data available is really important. To do digit analysis, to do machine learning, to do any of the stuff that we do as researchers, to do program evaluation, you can't do that without data on these public programs. And so transparency, 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 we all need the data available in order to do that. With that, here's my email address. You can find me very easily. I'm the only person named Jetson. And if you're interested, my website's also jetson.org. There's copies of all the papers we discussed today. And then I just want to open the floor and we can start doing some discussion and questions.